Okay, it's recording now. So it's Tara MacInnes, and could you spell that last name, please?
Yes, MacInnes is spelled M-A-C, capital I-N-N-E-S.
Okay, wonderful. So, the first question is about the stroke. I understand that you're 31 years old?
32, actually.
Okay. When did you have your stroke? How old were you?
I was an infant when I had my bilateral stroke.
You were an infant?
Yes.
Oh, wow. Okay, that's very unusual. Did you, was it a certain condition that you were born with that brought this on?
My strokes were essentially cryptogenic, which is what doctors define strokes as when they don't know what the underlying cause is, and I wasn't properly diagnosed with the condition that ultimately caused my strokes until I was 17 years old, and that condition is called moyamoya, and I'd be happy to spell that if you'd like me to.
Go ahead, yeah. You could spell it.
Yeah, moyamoya is one word, and it's spelled capital M-O-Y-A, M-O-Y-A.
Okay, have you had any subsequent strokes since that first one?
I had it was actually 2 strokes during infancy, one on each side of my brain, and I have not had complete strokes or CVAs, cerebral vascular accidents, but I have had numerous TIAs, or transient ischemic attacks, which essentially mimic strokes. They're simply not long-lasting enough to cause damage to the brain, but they're generally precursors or warning signs to a future stroke happening.
Okay. Now, I was going to ask you about the signs and symptoms because that's the focus of this piece. But so what I'm wondering is that if you had it at such a young age, how are you symbolic of stroke patients? Because most people who have strokes, my mom had them, but she didn't have them until she was 80. And then, you hear about strokes for people's in their 40s and 50s, 60s, 70s, on up. So I know you do a lot of work with the American Heart Association. How are you able to relate your experience to adults who have strokes? How are the two similar?
The main thing is oftentimes nowadays, especially with online resources available and means to do research other than, kind of, I hate to use the term old school now, but going to a library where that was your only option, to go to a library and start flipping through pages to do your research that way. Now, people have resources online. You're able to talk to people on the other side of the country or even the other side of the world. And oftentimes, not always, but many times nowadays when people do have a stroke, they realize that there were signs prior to the stroke that was like, hey, yeah, I experienced this, but I ignored it. I brushed it off. I thought it was nothing. And I've been able to relate to a lot of adults who have strokes as adults, and they say, yeah, I've been symptomatic. I've been having these things since I was in my teens or since I was, a child, and doctors either, ignored them or wrote them off or said, it's no big deal. This isn't alarming. This isn't concerning. And they continued experiencing things in many cases for months, possibly years, and then finally the stroke happens in adulthood. And particularly with the condition that I have, it is a progressive disorder. It just gets worse and worse and worse with time. It doesn't get better. It doesn't improve. And in my case, I was affected very, very young. Not everyone has such a fast progression rate as I did. The latest I'm aware of a moyamoya patient getting diagnosed was someone in their late 70s, whereas my strokes happened during infancy, but I wasn't properly diagnosed until I was a teenager.
Okay. So you're a spokesperson. You're involved in a stroke awareness. What do you tell people about what symptoms they should be looking for specifically?
Yeah, so in the case of moyamoya, and symptoms neurologically are often very similar, not exact, but similar from case to case. And in my case, signs and symptoms of the disorder that I have are migraines, seizures, TIAs, cognitive changes where, all of a sudden someone might be confused or disoriented. Things such of that nature, especially if they happen more than once in a relatively short period of time, my biggest encouragement is to not ignore those signs, not try to excuse the reason why they happen, such as, I was just tired. And that I've heard too many times from, now stroke survivors where they were like, yeah, I had, a stressful month and I had these symptoms and I just chalked my symptoms up to stress, or I just chalked my symptoms up to dehydration or exhaustion, this, that, and the other. I hear far too often from survivors.
Oh, yeah, I see. Because those things sound sort of common, like...
Very, yes, exactly.
So when you go... Did you have an event today that had anything to do with the stroke, or...
No, I actually was at church this morning and then a Bible study this afternoon.
Oh, okay. So what are your plans for May, for Stroke Awareness Month? Are you going to be involved doing anything?
So the first thing, I guess, to kick off May 4th, my fiance and I are getting married, and he is also a stroke survivor.
Oh.
That was very intentional for us when we got engaged. July of last year, we were like, when should we get married? And coming up with, getting married in May for Stroke Awareness Month, we were like, well, that's kind of, no pun intended, a no-brainer. Like, what other month should we get married? And we're like, May, Stroke Awareness Month. So,
well, congratulations. When did he have his stroke?
He is 31 years old himself. He had his stroke in 2011, June of 2011, when he was 23 years old.
That must have been a shocker to be 23 and have a stroke.
It was. He was active duty Coast Guard at the time, and the condition that I have, moyamoya, it's a neurovascular condition, and we do not have the same condition, my fiance and I. He had an undetected brain aneurysm.
Wow.
So another neurovascular condition, and basically his brain aneurysm ruptured, and that's how doctors found out that he had a brain aneurysm.
I see. Because if he's a 23-year-old in the Coast Guard, that sounds like a fit, healthy person as well as young. So I guess strokes, it sounds like, can happen to most anyone possibly. Huh?
Yes, and that is something that, both he and I have become super passionate about raising awareness for causes of strokes, as well as raising awareness for the fact that strokes can happen literally at any age. More and more it's coming out that pediatric patients as well as adolescent patients are having strokes, and as well as babies in utero. Babies in utero have strokes as well. So he and I are, huge advocates for the fact that, don't let age be the defining determinant as far as, if and when you can have a stroke, because literally strokes can happen truly to anyone at any age.
Well, I think that's very surprising news.
Mm-hmm. It's unfortunate, and it's surprising to most people who, I hate to say, aren't in the inner circle of people that, are the sibling of a pediatric patient who has a stroke, or the parent of a pediatric patient who has a stroke. But it's becoming much more known, and I, attribute a lot of that to social media and,
mm-hmm.
being able to do research online.
Okay.
With other people.
Well, I'm going to interview a couple of doctors about stroke, but I'll ask you, there are two types of strokes, to do with the heart and then to do with the neurology, our neurology, or our nervous central or nervous system, or vascular. And what are the two categories, cardiology and vascular?
The two generally, usually strokes are categorized as ischemic strokes.
And what does that mean?
I'm sorry?
What does ischemic mean?
Ischemic means that not enough oxygen is being delivered to the brain.
Okay.
and the brain strokes because of that.
Okay.
A hemorrhagic stroke happens when, for example, in Sean's case, my fiance's case, his aneurysm ruptured, and that was a hemorrhagic stroke. If you think of in brief, a short and condensed portion of hemorrhagic is hemorrhage. It bled.
Okay.
And that's what caused his stroke, was his vessel ruptured, causing the bleed, which subsequently caused his stroke. Whereas in my condition, both of my strokes were ischemic. My brain wasn't getting enough oxygen supply, and in turn, stroked.
My mom had a couple of strokes, and they termed them as wet and dry strokes. Does that mean something to you?
I've never heard that terminology.
Oh, all right. Well, okay, that's fine. I guess it's just a lot of stuff I don't know, so I'll have to find it out. So ischemic and the other one, and so anything else you want to add that since you are involved with awareness, anything that you want to touch on that we didn't talk about?
Not particularly, just the importance of, really for me, the biggest thing is not ignoring neurological symptoms. Because too often, again, in our culture, we're such a fast-paced, kind of on-demand, wanting what we want, when we want it, how we want it, and a lot of, the benefits of technology and just everything that we've grown in as far as technology and such, like that's been great, but at the same time, our expectations of things are so fast that we don't slow down often enough to pay attention to little things here and there that come up as far as symptoms go. And although they might be transient symptoms, they could be very serious at the same time.
That's good advice. Okay, and I just thought of something else to ask you. What do you and your husband do to ward off future strokes, or is it inevitable that you are predisposed?
Yeah. So when I was diagnosed with moyamoya, I was diagnosed in May of 2004, and I within a month thereafter, I underwent bilateral brain surgeries at the Stanford Moyamoya Center in California. I can give you the name of the surgeon if you want, who did my surgeries, but ultimately, in kind of layman's terms, the bypass surgery that they do for moyamoya is called, I had a direct bypass, and it's essentially very similar to a heart bypass, and you hear of heart bypasses all the time. But basically, the blockages in my brain, they didn't touch those whatsoever. They created new blood flow by rerouting my blood flow around my blockages or bypassing the blockages. So I had brain surgery on my right side. 2 weeks after I was diagnosed with moyamoya, brain surgery on my left side a week thereafter.
Okay.
I've been symptom-free and stroke-free since fall of 2004.
Oh, all right. Well, good for you. So does that mean that you have very little likelihood of having a stroke again, or not at all?
Not at this point. Obviously with medicine, there are no sure guarantees.
Yeah.
I do follow-up testing per the Stanford Moyamoya Center's follow-up protocol.
Okay.
So I basically, following my surgeries, my brain surgeries, I did follow-up at 6 months. Everything checked out great. Follow-up at a year, everything checked out great. My follow-up jumped to my 3-year anniversaries. Everything checked out great at that point. My follow-up then jumped to my 10-year anniversaries. Everything checked out there great.
Okay.
And now my follow-up has jumped to my 20-year anniversaries.
Okay, well, very good. Well, you have a long life ahead of you, so you just have to do all the health things that they prescribe. Well, thank you so much for your time. And this will be in the May-June issue of San Antonio Woman. And I'm sure you're going to be interviewed a lot in May by all the local media, too, if it's Stroke Awareness Month. So.
Yeah, and did you want, I got to say about me, my fiance has had a handful of brain surgeries himself.
Oh, I'm sorry.
No, that's totally okay. I just didn't know if you wanted his But he has had a handful of brain surgeries himself to keep him from having future strokes.
Okay. Well, I'm just sort of wondering what the future holds, because the thing is that, as I say, you're both so young, so you never, I mean, hopefully you're going to stay fit and healthy throughout your life to also reduce the chances, because if anyone is unhealthy or unfit or doesn't take care of themselves, their risk for stroke increases, especially as you go through your lifetime, huh?
Right, and that's very true. There are definite things that can increase someone's individual risk of stroke, such as smoking, heavy drinking, unhealthy lifestyle implications. For both John and I, the conditions that we have, that's not the case whatsoever. Neither one of our conditions were caused by poor lifestyle implications. As mentioned, he was active duty Coast Guard.
Right.
At the time, when I had my strokes, I was an infant, and then when I finally was properly diagnosed at 17, I was a double varsity athlete. At the time, as well as a club athlete. I was managing kind of 3 different schedules there. So,
that's what I was going to say. You're sort of, you're not symbolic, I would suppose, of most stroke. You're not typical.
Neither one of us were the poster children.
Yeah, right. So which must imply that it can be genetic as well. Are your conditions genetic?
So neither one of us have. Sean does not have any family members, to his knowledge, that have had aneurysms.
Oh.
I've not had any family members, to my knowledge, that have been diagnosed with moyamoya.
Okay.
That being said, on my dad's side of the family, between 1900 and 2000, there were a number of family members going, way far back generations that did pass away from strokes. And at the time, this was 40 plus years ago when they died, they were, attributed to poor lifestyle implications kind of things. Weren't ever diagnosed or looked into as far as an actual condition, an underlying condition possibly. So in hindsight, we kind of wonder if there were any family members in my family that had moyamoya, but we just don't know.
Okay. Well, you're taking care of it and you're getting wonderful care. So if you take care of yourself, then you should last. You should be able to get through the next 50 years okay, hopefully.
Both Sean and I at this point have very good prognoses from our doctors. Sean was treated at the Mayo Clinic.
What is your fiance's name again then?
His name is Sean, S-E-A-N.
Okay.
And his last name is Bretz, which is B-R-E-T-Z.
Okay, Sean Bretz. Okay, fine.
Yeah.
Okay.
He was stationed in Jacksonville, Florida at the time of his stroke, so he was immediately taken to the Mayo Clinic there in Jacksonville. I mean, he literally had no choice.
Yeah.
This is where the ambulance took him.
Yeah, aneurysms is do or die.
Yeah, that was phenomenal, just the fact that that's where he was stationed and that was the closest hospital that he went to. That was a huge godsend. And then, as mentioned, I had my treatment at Stanford Moyamoya Center.
Yeah, okay. Well, thanks so much. If I have any follow-up questions, is it okay if I email you and you just write me back?
Yes, that's totally okay.
Okay, because I might have some follow-up questions, and you can just send me whatever else I might need just on an email. That'll do fine.
Do you need any pictures? Or
I was wondering if you could send a photo. Joseph, I think he said that you would have something you could share, so...
Yeah, I have engagement pictures that we did, so I can provide those for sure. Yeah,
that would be fine. Yeah, just email them to me, and that would be terrific.
Okay, would it be helpful to have any pictures of me during infancy, just to emphasize how old I was?
Well, yeah, you could go ahead and send something. It never hurts.
Okay.
So that's fine. That would be fine too. Whatever you think is illustrative of your experience, and that would be great.
Perfect. Thank you so much for doing this.
Yeah, thanks so much for talking with me today on your day off, huh?
Yeah, of course. Thank you again.